I'm going to present a case of a vaccine-injured person. This is CP, a 65-year-old female who had the mRNA COVID shot, um, a single Moderna vaccine, and then had an immediate injury or illness. This happened in January of 2023. We started LDN immediately, was in prior and titrated up to 3 milligrams per day. Um, for the dermatitis, an exacerbation of this vaccine, we used naltrexone topically, a 1% solution, and with some other agents to help with the itching that this woman had. That was her main presentation, was a dermatitis, an eruption that occurred right after the vaccine. There was a temporal connection between that. So we provided a topical to be applied to the affected areas twice a day to cover the lesions. At her 45-day follow-up call, which was January 25th of 23, she was doing much better and attributed most of the success of her treatment with the low-dose naltrexone. It was discovered she had underlying tick-borne disease, namely Borrelia, and also Bartonella and Babesia, as well as anaplasmosis. So all of those were treated, and once they were discovered, and her condition improved dramatically in a stepwise fashion. The second case, again, of vaccine injury, involves a gentleman, MG, who is a 69-year-old male, very active, CEO of at least one company, an aviator as well. He was an avid hunter and had many experiences up in the deer stand of tick exposure. He was a very type A overachiever type, and he was devastated by his injury. He had a single Moderna vaccine and immediately fell ill with cognitive impairment. He had word hunting. He had memory loss, fatigue. He couldn't keep up with his buddies any longer, which really bothered him. And he went through almost a full year of treatment with many different modalities, including ozone therapy, stem cell, you name it. He's seen multiple neurologists with no effectual improvement. He had also intractable insomnia, stating he had maybe 1 to 2 hours of sleep per night, and this went on for almost a year. He also had loss of the use of his legs. I mean, he could stand, but he couldn't walk for very long. Chronic regional pain syndrome as well. His initial visit was January 4th of 23. And his very, very first visit, he had suicidal ideations. He couldn't remember much to give me a history, and we had to end it very suddenly and pick up a few days later to finish his onboarding to our center. But we immediately started working on his sleep with LDN, immediately starting at 1 milligram per day and titrating up fairly quickly, about every 2 to 3 weeks. We also implemented trazodone for sleep. My nurse was tasked to call him back within the next week after his first visit, and his mood was much better. He was no longer suicidal. He had achieved some improvement in his insomnia. He was on the trazodone, especially, feeling that he was getting about 6 to 7 hours of sleep, and just that improved his overall condition. We changed his LDN to a BID dosing schedule to help with the chronic pain, and that did work out nicely for him. We then discovered through testing that he was Lyme positive, had a background Epstein-Barr, and an elevated homocysteine. All of those were addressed within 30 days with treatments for his Lyme and his viral burden. And with the history of the avid hunter and lives in the northeastern USA, Lyme was basically speculated and was tested and was positive by CDC criteria. He also had the tick-borne relapsing fever, as well as other Borrelia species. We did notice his Epstein-Barr titers were fairly elevated, and his homocysteine was above 10. So the take home is whether COVID infection or injection, always look for underlying chronic illnesses, tick-borne illnesses, mycotoxin illnesses, heavy metals, etc., because that could get in the way of your patients getting better on just the fundamental FLCCC protocol.